Hello, my name is Anjali and I'm a fourth year medical student at Nottingham University. Today, my presentation is on factors influencing the post-operative length of stay in patients undergoing total laparoscopic hysterectomy. This is a single center review of 574 cases over a 12-year period. Laparoscopic surgery is now widely used in the field of gynecology, and it has a number of benefits compared to a laparotomy. For instance, it's shown to have reduced length of hospital stay, shorter recovery times, less pain and wound complications postoperatively. As well as this, it reduces the risk of bowel or bladder dysfunction by offering better visibility of the surgical field. Having said that, it does require a great amount of training and skill for a surgeon to become competent in the field. It is therefore associated with a long learning curve. This particular study is based at Royal Derby Hospital, which is the leading centre for gynecological surgery in the UK. This graph shows the change in the number of hysterectomies performed by laparoscopic and abdominal approaches from 2007 to 2019. You can see that TLHs only started at Royal Derby Hospital in 2008, and they were performed at a steady rate until 2012, when the numbers began to increase significantly. By 2016, you can see that TLHs were consistently performed more frequently than abdominal hysterectomies, and this study will therefore focus on TLHs specifically. The aim of this study is to A, see how the trend in postoperative length of stay following TLH has changed over a 12-year period, and B, identify the perioperative factors that have an impact on postoperative length of stay. To do this, we retrospectively reviewed all patients who underwent TLH under the care of a single surgeon. The surgeon who had completed the most TLH procedures was selected for this study, and all operating notes between 2008 and 2020 were retrieved. Data was collected on patient age, body mass index, and total inpatient length of stay in hours following TLH. The data is presented as means, percentages, and univariate analysis was performed to determine significance. This was established as p is less or equal than 0.05. Over the 12-year period, 3,390 hysterectomies were carried out at the Royal Derby Hospital, out of which over 1,500 were TLHs. The surgeon in question had performed 574 cases, which is what I was analysing. In 2008, the mean postoperative length of stay was 56 hours. This dropped to 34 hours in 2020. You can see the downward trend on this graph showing a decrease in the mean length of stay over time. I then looked at the relationship between postoperative length of stay and age. This graph shows the average length of hospital stay in relation to the different age categories, and illustrates an upwards trend. However, there was no statistically significant difference. I then divided patients into less or equal than 50 years old and those over 50 years old, as represented by this graph. On average, women less or equal than 50 years old stayed in hospital for 33.8 hours post-surgery, compared to those over 50 who stayed in hospital for 46.1 hours. and this difference was significant. Following this, I analysed the relationship between postoperative length of stay and BMI. This graph shows the average length of hospital stay in relation to the different BMI groups, all the way from underweight to morbidly obese. Again, this graph shows a cleared upward trend, but no statistically significant difference. I then grouped patients who were either underweight or healthy weight together versus those that were overweight, obese, or morbidly obese. This showed that patients with a BMI of less than 24.9 stayed in hospital for 33.6 hours post-surgery, compared to those with a higher BMI who stayed in hospital for 44.7 hours. And this difference was significant. In conclusion, this study found that there was a decrease in postoperative length of stay following TLH over a 12-year period. This is likely a reflection of the learning curve associated with minimal access surgery and the result of increasing operator experience. Whilst laparoscopic surgery is accepted as generally conferring to shorter length of stay in comparison to a traditional approach across all patient groups, our data would suggest that women less or equal than 50 years old and with a normal BMI benefit most from adopting a laparoscopic route. This is an important point for patient counselling, theatre list and bed planning, and even patient selection in centres offering day case TLH. This is an area of debate because from published research, we know that day case hysterectomy is considered safe and feasible, but is it appropriate? Patients undergoing hysterectomy have a spinal anaesthetic in our department, and we therefore like to keep them in overnight to make sure that they're comfortable and stable after what is a big operation. Further investigation must be done to identify other factors that may have had an impact on postoperative length of stay in hospital, such as delayed discharge due to admin factors or other medical reasons as to why a patient's discharge may have been delayed. This analysis is currently underway. Thank you very much for listening.